Okay, hello. My name is Rachel Plummer, and today I'm going to be interviewing my mom, Sarah Dinklage, who is a two-time breast cancer survivor. And the purpose of the interview is just to learn a little bit more about the experiences of a breast cancer survivor and patient. So let's begin. So, Mom, when did you have breast cancer for the first time?
I was first diagnosed with breast cancer in May 1999 when I was 43. I had been having annual mammograms since 38. I had gone and requested to start having mammograms after a tenant living in our apartment died of breast cancer. And the next time I had a biopsy, it showed early stage breast cancer. When the biopsy showed breast cancer, it was diagnosed DCIS, which is ductal carcinoma in situ, which is stage 0, so it's the earliest stage of breast cancer. The recommended treatment was to have a mastectomy, and people, when you tell people that, they say, well, how could you have that extreme treatment with earliest stage 0 breast cancer? The reason for that is the DCIS was throughout the breast. It wasn't in just one cluster that you could remove with a lumpectomy. I had a mastectomy with no other follow-up treatment, though that it was considered. Other treatments were considered.
How long of a recovery did you go through after the surgery?
Well, recovery from the surgery, it was an overnight hospitalization. I think I spent 1 or 2 nights in the hospital and sent home in recovery in 6 weeks. The surgery was performed in late May. I was back running on the 4th of July. All of the opinions were that the cancer had been, removed, and there was no need for any further treatment.
What types of feelings and emotions were you experiencing with this whole process?
Well, I'll tell you, the primary feeling was fear of the cancer. That was the overriding concern that I had. The idea of losing a breast, having a mastectomy, is daunting, but the main thing is you want to get rid of the cancer. Whatever it takes, you just want to get it out.
When you did have cancer the second time, was that a recurrence because the margins were not clean when they removed the tissue?
Well, the margins were clean. A mastectomy will almost always cure DCIS, but in rare cases, I think I was told 2% of the time, cancer can come back after mastectomy because it's not possible to remove all the breast tissue containing breast cancer cells. Prognosis-wise, I think the less ominous picture was that it came from the previous DCIS.
Would radiation or chemotherapy after the mastectomy, would that have prevented the recurrence, do you think? Or did your doctor?
That's a very good question, one that I've certainly asked and everybody else has wondered, and we don't know.
At what stage was your cancer the second time when it was diagnosed?
It was considered advanced. It was a tumor at the midline, the chest wall. I think they considered it 3C, stage 3C. The other part of staging has to do with lymph nodes. What she did was what's called a sentinel node biopsy, where she identified one of the nodes, and in fact she did, and took out 6 nodes, and all were benign. It was not metastatic breast cancer, it was not stage 4, but it was, again, about as advanced as you could get.
What were your treatment options for this second time around, and which ones did you end up pursuing?
The treatment options, there really weren't any options. There weren't like choices. The recommendation was for, aggressive chemotherapy, followed by radiation, and then a regimen of 5 years of tamoxifen and Arimidex. I was put on what was considered the state-of-the-art, state-of-the-science chemo regimen. I believe it was 8 treatments every other week. And then followed by 6 weeks of radiation, which is every day. And then I took tamoxifen for 2.5 years and Rivodex for 5. So that was the actual regimen. I had all of the usual suspects. I had loss of hair right away after the second treatment, which was the most dramatic side effect. But I also had nausea, though not extreme, fatigue, low white blood cell count, but never dangerously low, mouth sores. That was for the chemo. My oncologist told me to expect to be at 80% capacity, which I would say is pretty accurate. I continued to work, I continued to exercise, and live my life just at 80% of what I would normally have been at, probably. Radiation was very difficult because of the way that my cancer was on the surface of my skin. They really had to they had to do a very very high, strong level of radiation, which resulted in very serious burning of my skin. It wasn't just like they say a sunburn. This was like having a burn.
So what would you say was the hardest part of this whole experience, emotionally or socially or physically?
I would say, well, the most difficult part was all around the, waiting for diagnostic results, because that's, again, like I said, going through the treatment is very tough, but you're getting treatment. The hardest part for me is, I think for a lot of people, is just waiting to find out how bad is it. Did we get it? That was difficult. And then the other most difficult part was the impact this had on my family, particularly my children, and particularly you, who were younger. So I think that it had I think it was very scary and difficult. That was the hardest part for me. You were very, I would say, almost hyper vigilant. Like, you check every time you got off the school bus. I could see your eyes doing this full scan of me, just checking out, like, how was I? And it was you had enough understanding, much more than you did when you were 3. So it was scary. And thirdly, I would say what was hard was really, it is the change in one's appearance that's very difficult. So, it was also hard to lose my hair, my eyebrows, my eyelashes at the end. And then you look sick. You look in the mirror and then you look sick. And that was tough.
So on a more positive note, tell me about the moment when your doctor said that you were cancer-free.
Well, there were a couple of times, when my doctor first told me cancer-free, interestingly enough, was when they removed the tumor before I even started chemo. They said, okay, as far as we know, we've got the cancer. There's no indication that it's anywhere else. However, just to be sure, we're going to whack you with this, very powerful treatment regimen. So that was some feeling of relief that this was all a super duper precaution. Then when the treatment was over, again, there was this feeling like your prognosis is very good, you're cancer free. But the most relief and happiness I felt was after 10 years, which just happened, where my oncologist said, you've reached the 10-year mark. You don't need to come here anymore. To be followed by your oncologist, and so that was a real feeling. Wow. I remember each year that went by, I felt good. The longer you go by, the better the prognosis is, less chance of it coming back. But I knew in my head that it's the 10-year mark point.
And so I know you probably wish that you never had cancer, but what were sort of the takeaways and what did you gain from the experience?
Well, I gained, and everyone would say this, like a super great appreciation for life. I learned about how strong I am, and I'm very proud of that. You don't know what you can go through until you go through it, and I feel like I am strong, and I became strong. Could have curled up into a ball and just like taken off from life during that period, but I'm proud that I kept working, I kept productive, exercising. We actually took in an exchange student right when I was in the middle of chemotherapy, and I just, kept living my life, and I think that's what I take, that's an important thing to take away. In terms of if there was thinking about if I would have done anything differently, what advice would I give? Everybody praised me for being so open with my family and children and talking about it very practically and matter-of-factly, and not keeping secrets, because children always worry about that. But I wished I had conveyed less uncertainty. I got stuck in this thing about I can't, you shouldn't lie. When you say you're going to die, you should never say absolutely not, because you don't really know. And in hindsight, I wished I had just conveyed, of course I'm not going to die, and less uncertainty.
Well, thank you very much for sharing these experiences with us.